Hello, my name is Dr. Brian Warden. I'm a Stanford-trained ear, nose, and throat specialist. I've been in practice for 15 years, and I'm here to discuss some additional useful insights about tinnitus. Now, our topic of conversation today is pulsatile tinnitus. So let's first discuss what that term actually means. Now, the vast majority of people that have tinnitus have what we call non-pulsatile tinnitus, meaning that they have a sound that they perceive that's rather constant in character. It may be a buzz like bzzz, or a hiss like sss, or a tone like beep, or something of that nature. Now, people that have non-pulsatile tinnitus can observe fluctuations in the loudness and the severity and the character of their tinnitus, but most of the time it's rather constant. Now, this is different than what we call pulsatile tinnitus. So people that have pulsatile tinnitus have a more variable sound that they perceive. And that may be a clicking sound that repeats over and over again, or sometimes a pulsing sound that people perceive. Now, clicking pulsatile tinnitus may have several causes. It may be due to a jaw joint problem, especially if somebody is perceiving a clicking sound when they move their jaw or when they're chewing their food. In other circumstances, a clicking pulsatile tinnitus may be due to a person perceiving the opening and closing of their eustachian tubes. And the eustachian tubes are the air valves of the ear that connect the middle ear space behind our eardrums with the back of our noses. And finally, others that have a clicking pulsatile tinnitus may actually have a spasm of one of the tiny muscles of the middle ear behind the eardrum, or sometimes one of the palatal muscles. Others that have pulsatile tinnitus have more of a whooshing sound that has a similar rhythm and rate to a person's heartbeat. And those people are generally perceiving the sound of blood flow in some of the blood vessels of the head and neck area. And because that kind of pulsatile tinnitus, this whooshing pulsatile tinnitus, can be a sign of a blood vessel problem, it oftentimes will prompt some additional investigations and evaluations by a knowledgeable specialist, whether that be an ear specialist like an otologist, neuro-otologist, or sometimes a neurologist would do that kind of evaluation. Now, interestingly, I have found in my clinic, and there are papers that have been written about this as well, that pulsatile tinnitus is much more common in people that suffer from migraine. And that's probably because migraine sufferers can have sensory hypersensitivities, not only to sensations coming from the external world, but also sensations coming from the internal bodily environment. However, other people that have whooshing pulsatile tinnitus may have an actual anatomic blood vessel problem. And that could be a narrowing of one of the veins that's draining blood from the brain and the skull. It could be due to an abnormal connection between veins and arteries in the head area, or other similar vascular anomalies. And if somebody has a blood vessel problem like that, it is something that sometimes can be treated by a specialist called a neurointerventional radiologist. And in many circumstances, an intervention by one of these specialists can dramatically reduce the pulsatile tinnitus that's bothering a person. In other more rare circumstances, pulsatile tinnitus may be related to certain kinds of tumors in the head and neck area that may require additional treatment. And in some circumstances, pulsatile tinnitus can be a sign of increased fluid pressure in the fluid that bathes our brain and our spinal cord, what we call the cerebrospinal fluid. And when people have increased pressure in that fluid, that is also a treatable condition. So if it is properly diagnosed, there are treatments that can be instituted that not only improve the pulsatile tinnitus, which is bothersome to people, but also reduce the likelihood that this causes more significant problems down the road. So if somebody has whooshing pulsatile tinnitus, I do recommend that they seek out a thorough evaluation by a knowledgeable specialist, whether that be an otologist, neuro-otologist, or a neurologist that's knowledgeable about this situation. In my clinic, when somebody comes in with a complaint of whooshing pulsatile tinnitus, they get a very thorough history and a very thorough head and neck examination, including a microscopic examination of the ears. They have a full hearing test. And we also will listen to various areas of the head and neck area with a stethoscope to see if we can actually also perceive this pulsing sound that the patient is reporting. If after that kind of thorough evaluation, we're not able to determine the source of this pulsatile tinnitus, we usually will start ordering imaging studies. And there are different imaging studies. Imaging studies are scans. There are different imaging studies that can be helpful in this circumstance, but oftentimes we're ordering special kinds of MRI scans and CT scans that look at the blood vessels in the area. Sometimes we also have to do investigations about whether or not there's evidence of increased pressure in those fluid compartments around the brain and the spinal cord. Sometimes that includes a very thorough evaluation of the back of somebody's eyes, or even sometimes a spinal tap, a lumbar puncture where a needle is passed into the CSF space along the spinal cord, and we can actually measure the pressure of that fluid to determine if that is normal or not. The good news is that most of the patients that I see in my clinic that have pulsatile tinnitus do not have a dangerous or life-threatening problem, and sometimes we identify a very treatable cause of pulsatile tinnitus that after having an appropriate treatment, patients can see significant improvement in the severity of their pulsatile tinnitus, and sometimes it goes away entirely. So that may be favorable for some folks. Again, if you have any questions about this topic, please leave them in the comments below. I hope that you find this information useful. As always, if you appreciate our content, we love it when people like our videos or follow us on social media platforms like Facebook or Instagram, or you can subscribe to our YouTube channel. If you have suggestions for issues or topics you'd like me to discuss in future videos, I'd love to see those comments as well. And again, reaching out to all of those tinnitus sufferers out there, hang in there. It is not hopeless. There are things that we can do to reduce the severity and burden of tinnitus. Continue to support each other. We're all in this together, and I'm confident that if we take the right steps, there can be brighter days ahead. So thanks again for watching.